Yes, Tawam Hospital is a 460-bed tertiary care facility with a major teaching component, medical residents, pharmacy students, etc. And we're developing a residency program as well. We treat a wide variety of complex patients, and we have the pharmacy staff associated to treat that wide variety and specialties. I've been at Tawam just over a year now, and during that time, I've enjoyed the cultural diversity of Tawam. In addition, working with the pharmacy staff, mentoring them, sharing my vision of how hospital pharmacy should practice. And it's been a great experience for me, and I've truly enjoyed it. First of all, adverse drug reactions in the Emirates are similar to other areas in the country, totally under low reporting. So we need to have more structured programs for adverse drug reaction reporting. We also need to develop a heightened awareness, pharmacists, physicians, nurses, on the importance of reporting adverse drug reactions. We need to communicate and educate more information about the issues around adverse drug reactions for our patients. I'm encouraged by, in the time I've been here, the emphasis that we are here in the Emirates putting on medication safety. And we've had many conferences on medication safety. We need to step it up and include adverse drug reaction reporting as part of that med safety program, development, communication, education. It's very important. One of the purposes of my presentation yesterday was to increase the awareness of adverse drug reactions and see that we can increase reporting. The main issues I tried to address was, one, make sure you have a good definition. You have to have a solid definition of what you consider an adverse drug reaction is. Secondly, you need to communicate that to your staff and give them an expectation. Without expectation of what a reaction is, without an expectation of what you expect for them for identifying, reporting, and follow-up is very important. And finally, you need to do something with the data. You collect all this information, but you need to do something. You need to work on process improvements to reduce adverse drug reactions. You also need to work on communication and education of staff at all levels. And those are all very important steps that we need to take. That's correct. I think conferences such as this Congress are extremely important, bringing pharmacists together. In the past 2 days, I've seen a lot of passion, and I see a lot of people that are very motivated on medication safety. So we need to look at that from the standpoint of medication safety, looking at adverse drug reactions as a part of that. Heightened awareness, increased education. These congresses give people the opportunity to discuss, generate ideas, and also in some cases give them tools they need to move forward with medication safety. And on adverse drug reaction reporting, I hope I accomplished that yesterday in my presentation. I think this Congress and others are part of the journey. So we have some people that are new to their profession, practice of pharmacy, and we have some people that have been pharmacists for a long time. So some are starting that journey and some are continuing that journey. As long as we are motivated and have passion for our professions and keep the patient as the #1 reason why we practice pharmacy, we'll do great things going forward. And thanks for this opportunity.